Hi there. As the Director of Education, I lead the design, implementation, and evaluation of educational activities at the Steinberg Center. Optimal patient care is at the heart of everything we do. We are all continuously learning and improving so that we can maximize the delivery of safe and high-quality clinical care. Educational activities range from teaching procedural skills on synthetic and real tissue models or task trainers, to enhancing communication skills using simulated patients and practicing interprofessional team training in a high-fidelity simulation suite with computer-operated mannequins. We also teach home care scenarios in our simulated apartment. All of our workshops are organized in partnership with dedicated faculty who care deeply about the delivery of authentic learning experiences. With so many innovative changes taking place in our modern world every day, the learning never stops. We train emerging and current healthcare professionals using the latest technology and methods. We also offer faculty development workshops to train clinicians who wish to engage in simulation-based education so they can improve the learning for their learners. And we're fully accredited by the American College of Surgeons and by the Royal College of Physicians and Surgeons of Canada. Let's explore some of our clinical areas together. After signing in and changing in the locker rooms, our learners head to the conference room to prepare for their workshop. Our conference rooms are used for didactic teaching, presentations, workshops, and debriefing sessions. We have a large conference room that can seat up to 60 people and a second large conference room that can accommodate another 45. We also have 4 smaller conference rooms for up to 14 to 16 people at a time. All of our clinical rooms have full audiovisual capability. Terry, our on-site AV technician, will tell you more.
Hey there, I'm Terry. I'm based at the Steinberg Center and provide support for all desktop and audiovisual related requests. So when it comes to questions about technology, don't hesitate to reach out and let's see what's possible. Scenarios taking place in the high fidelity and OR suites, the clinical exam rooms, and the patient ward can all be captured through our Beeline system using cameras and audio equipment installed in those rooms. This can then be projected to the conference rooms for live viewing or recorded to review with the learners during debriefing.
Thanks so much, Terry. We're really lucky to have you on our team. Next, let's visit the High Fidelity Clinical Suite. In this room, learners participate in clinical scenarios to practice crisis resource management, decision-making, and interprofessional team training. They use patient simulator mannequins that are operated by technicians from the control room. We also have a high-fidelity operating room. Similar to the high-fidelity clinical suite, this room is ideal for trauma-based scenarios and allows for team training in interventional areas like the OR or interventional radiology. Right now, you're viewing a simulated trauma scenario. A toddler was hit by a car while biking with his dad and was brought to the emergency room where the team must work together to save his life. Lily, our simulation trainer, is managing the scenario and operating the wireless patient mannequin behind a one-way glass in the control room.
Hello, my name is Lily and I am a respiratory therapist. My role as the simulation trainer is to make sure that the simulated scenario unfolds well and to recreate authentic clinical conditions according to the learning objectives so that the participants are fully immersed into the simulation. The high-fidelity mannequins can replicate realistic anatomy and clinical functionalities, which allow a variety of medical interventions. All changes in the physiological states reflect the learner's action and are controlled through a laptop at a click of a button.
Now that the scenario is over, the participants will gather for a debriefing session. Debriefing is at the heart of what we do in simulation. It allows participants to gain a clear understanding of their actions and their thought process through discussion. This is where the real learning happens. It helps to solidify learning outcomes and enhance future clinical performance. Our center is a safe space where learners can talk freely about their experience and where mistakes or learning opportunities arise. Let's see what our learners say about their experience in this simulation.
We had the opportunity to run a high-fidelity trauma scenario, and so engaging with a team to actually tackle a very complex situation was something that as a medical student was incredibly informative and eye-opening, because it offered us the opportunity to see where we will be one day, but at least to develop the basis in an environment that's safe.
Everything set up here is made for you to actually get really involved in what you're doing, and you forget about the fact that it's a simulation. You actually think that it's the real thing.
I'd have to say that simulation has been one of the most important things that we've done throughout our nursing. It's something that's integrated not only as an exam, but throughout our classes. And I feel that it's really a place where we get to practice building those relationships with these well-trained actors. It helps people with nerves, and it really allows us to make mistakes in a situation where the mistakes can be made.
We also have 10 clinical examination rooms that can be used for encounters with simulated patients or for practice with task trainers or mannequins. All of these rooms are fully equipped with oxygen, suction, and basic medical equipment. They can be set up, for example, as a hospital room, an emergency room, or a bed in an intensive care unit. One-way mirrors and audio capacity allows professors to view and listen to the encounters. There are 2 doors leading into each room, creating separate pathways for learners and their teachers. In our technical skills room, there are 16 mobile workstations where a full range of medical and surgical procedures can be practiced. This area can be divided into 2 smaller rooms to accommodate multiple workshops at the same time. Individual monitors and service columns enable each student to work independently while watching the procedure on their monitor. This room is set up according to the training, using simulated patients, mannequins, task trainers, tissue samples, cadavers, or a combination of the above for optimal learning. We can provide different types of tissue to practice on, including synthetic, animal-based, or even cadaveric. Also located outside this area are realistic scrub sinks. When medical students prepare to start their clinical rotations, this is where they learn how to properly scrub, gown up, and prepare for the operating room. Right now, there's a surgical foundations workshop with McGill residents taking place in the technical skills room. Let's observe as Somali, our surgical skills coordinator, explains what's going on.
Hello. As the surgical skills coordinator, I'm responsible for hands-on procedural skills programs that take place at the Steinberg Center. My role is to make the necessary arrangements to accomplish the goals and objectives of these programs and to make sure that the programs are running smoothly. I was a physician overseas before I joined the Steinberg Center over a decade ago in 2009. Having this medical knowledge and clinical experience allows me to carry out my role here very efficiently. The technical skills room is one of the busiest areas at our center. Different types of medical and surgical procedural skills workshops take place in this lab every day. Today, we have a surgical foundation program for first-year surgery residents. Here they will learn how to perform some of important and critical surgical procedures related to tubes, lines, and drains. We have 6 stations for the students to rotate through. We have a large inventory of instruments for wet and dry labs. At the end of each lab, all the instruments that we use need to be cleaned. First, we use our instrument washer to wash the instruments, and then we use the autoclave for sterilization, selecting the proper cycle depending on the types of the instruments and the program we had. After properly cleaning, the instruments are stored back in their specific containers. We also make low-cost models using easily available resources so that our learners can practice skills such as abscess drainage, epistaxis, nerve block, surgical airways, and more. When a program requires a new model, I consult the relevant faculty members and develop the model according to their requirements. Here is an example for femoral nerve block that I made using items that are easily available.
Making sure that our workstations are set up properly and that our faculty and learners have everything they need takes a lot of planning. Our simulation technicians, Augusto and Tuino, work hard to provide the needed support.
Hi there. Before coming to work at the Steinberg Center, I work as a physician in Cuba. My medical background allows me to understand exactly what our learners and faculty need when organizing their training workshops. In our storage room, we keep a large inventory of equipment so that we can accommodate the many different types of workshop that takes place at the center. In addition to the high-fidelity mannequins that we saw earlier, we also use mid-fidelity and low-fidelity mannequins, and we have a large inventory of task trainers and simulators designed to practice specific procedures. We have fully functional diagnostic and monitoring equipment like anesthesia machines, crash carts, defibrillators, ventilators, and ultrasound machines. All these allow us to accurately recreate the hospital or clinical environment.
Thanks so much, Augusto and Tuino. We really appreciate the expertise and positive energy that you bring with you every day, not to mention the fantastic singing, Augusto. The last clinical space that we will look at together is our simulated patient ward. This zone recreates an entire clinical ward space, including a nursing station, 4 patient rooms, and a control and debriefing room. After a busy morning of training, our learners can take a break in the student touchdown room, where they can grab a bite to eat, catch up on their emails, and put their feet up for a few minutes. This unique space has a fully equipped kitchen and a wet bar, lounge and dining areas, and wireless workstations. Before you continue your visit with Dr. Freed, I wanted to talk briefly about how we're extending beyond traditional boundaries to bring simulation to the broader community. Nikki Solis, our education manager, recently led a human trafficking initiative with Françoise Fillon and our officers from the Montreal Police designed to help healthcare professionals identify and advocate for victims of human trafficking. That group recreated a plenary panel at the Royal College Simulation Summit in 2019 to show the rest of the country how we're moving simulation in different directions here at McGill. Locally, we've also created a new Simulation on a Social Mission Committee to ensure the priority healthcare, cultural, and social needs of the community are represented in simulation-based education at McGill by promoting patient-based simulation that reflects authentic patient voices. As we say in that committee, good education changes what you know, really good education changes how you think, and great education fundamentally changes who you are. We want that for our learners. We want them to think differently about socially important activities.
Thanks, Farhan. Now that you've had a chance to visit some of our clinical zones, you can see why we are recognized internationally as a leader in medical simulation.